This is the Emergency Medical Minute, sponsored by Health One.
Hi everyone, so today we'll be talking about buprenorphine and opioid use withdrawal. So this is something that's kind of in the pipeline that we'll be executing here in a couple of days, or not sure exactly when it's rolling out, but just wanted to give you a brief overview of what buprenorphine is. So it is a semi-synthetic derivative of the opium poppy. So it is actually FDA approved for the treatment of opioid use disorder and for chronic pain as well. But why we want to use it in the emergency department is because it has a ceiling effect. So this means that it can help suppress those withdrawal cravings without producing so much of a high. It also has less adverse effects compared to other agents. What we have stocked here in our Pyxis is the sublingual tablet. It has an onset of action of about 30 to 60 minutes and the peak effect in about 1 to 4 hours. The duration of action is dose dependent, so this is important to remember because with lower doses, it has around a 6 to 12 hour duration of action, but for higher doses of greater than 16 milligrams, you have a duration of action around 24 to 72 hours, so 1 to 3 days. So how do we decide who gets buprenorphine in our patients? So if they're in active opioid withdrawal and they have moderate or severe symptoms. And these moderate or severe symptoms can be classified using the COWS assessment or the Clinical Opioid Withdrawal Symptoms Scale. And this scale kind of just takes into account heart rate, sweating, restlessness, tremor, their anxiety, their bone and joint aches, and their runny nose. And you kind of compile all these numbers, and we'll give you a little bit more information on what COWS is in the little handout that I'll be handing to you guys. So if they have moderate to severe opioid withdrawal symptoms, you're going to want to first administer around 8 milligrams of the sublingual buprenorphine. And since it has an onset of action between 30 to 60 minutes, you want to wait 1 hour and then reassess that patient. At the time of reassessment, you can give them another dose, or you want to give them another dose of buprenorphine. And the second dose can be either 8 to 24 milligrams. So how do you decide which dose to give them, low or high dose? So the low dose, the 8 milligram administration can it lowers the risk of sedation. However, it puts them at a higher risk of withdrawal within 12 hours. So you have to weigh the risk and benefits of this. With the high dose administration, it has increased effects of suppressing those cravings, and the duration of action again is around 72 hours. So they don't have to follow up as quickly as with the low dose. So with the low dose, they have to have a prescription and follow up within the next day to get a new prescription for the buprenorphine, or they will go back into withdrawal. Some clinical pearls with buprenorphine. So if a patient is actively using opioids, or if they're intoxicated with opioids, you're not going to want to administer the buprenorphine because the buprenorphine has a higher affinity for those opioid receptors. And what that's going to do is it's going to actually precipitate a withdrawal in those patients. So if they're coming in with on opioids already, do not administer this medication. Some other side effects that you can see with this is tachycardia, dilated pupils, restlessness, agitation, some muscle and joint aches, and then diaphoresis as well. One last thing with the buprenorphine, it does cause QTc prolongation, so if they're on any other medications that can exacerbate that, you have to kind of monitor them and, again, weigh the risk and benefits of administering this medication. And that's kind of a brief overview of buprenorphine. We're going to have a little handy-dandy handout for you guys in a couple days here. So thank you very much.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.